We are going to run through lower back mobility. We're going to start dynamic. We're going to get the joints moving first tonight, and then we're going to go into some longer stretch and holds. So we're going to start with a few, we're actually going to start standing. We'll then go on hands and knees. We'll work our way down towards the ground. The same rule applies as always, which is we don't really want any pain. If there is any pain, just find the range that you're comfortable with. Do not worry about pushing into pain or discomfort. The rule really is just to keep pain at an absolute minimum. I'll drop some tips along the way if you do have pain anyway, and you can always drop a question in the chat as well. So today, the way we're going to start today is we're going to do some hip hinges. So to perform our hip hinge, we are going to stand nice and tall. We're going to have our feet parallel to each other. In fact, I'll just get this down a little bit more. We're going to have our feet parallel to each other. That's better. Just like that. I'll just show you the side view. And we are going to start to practice hip hinging. So the way that we do this is we're going to be our hands on hips. We're going to set our bum back. And we're looking to feel a bit of a stretch in the hamstrings. We're looking for a flat back through there. And then we're going to come back up. So that's called a hip hinge. So bum goes back. Chest stays upright. Back remains neutral. We push our legs into the ground to come back up. A common mistake with this one is people let their knees track over their toes. We want to keep our shins, what we call the shin angle, we want to keep that vertical to the ground the whole time. And that means that we're actually mainly moving from our hips and nowhere else. So let's work through another 6 of these. Bum goes back, feeling that stretch through the hamstring. The little things you learn on the webinars is having a necklace near the microphone. Not such a good idea. Good. Let's go 3 more. 2 and 1. Beautiful. Okay. Next exercise we're going to run through is going to be something called a windmill. So a windmill is now going to open up our hips really, really well. Kyle, yeah, so hip hinge is the movement pattern. Romanian deadlift is the actual exercise. So if you have weights, that's what we call an RDL, or Romanian deadlift, but the hip hinge is the movement pattern, basically, but absolutely spot on. So the next thing we're going to do is something called a windmill. So your windmill is now going to stretch the inner hamstrings. It's going to also give you a bit of a stretch down your side body. So you're going to start by standing up nice and tall. We're going to point our feet outwards. So we want quite wide feet and turned outwards as well. Let's take our right arm straight up, our left arm straight down. And we're going to do a hip hinge, but this one is a sideways hip hinge. So I'm popping my right hip out to the side and I'm reaching my hand, my left hand goes straight down to the ground, and then I'm coming back up. So right hip goes out. I'm trying to keep my legs straight, by the way, as well. And back up. Now, I generally like to keep my eyes up on my fingertips on my top hand. It's up to you, though. And we should be feeling, just keep going and practicing as I talk here, we should be feeling a good stretch down the inner thigh. So it's kind of more on the inside through there. And you'll likely feel a bit through your lat there as well. Some people will find this quite awkward. In fact, it is quite an awkward stretch because it's not one we do very often. But part of looking after our back is by moving in ways we don't move often, having what we call movement variability. So having a variety of ways in which we can move our body makes our back a little bit more resilient. Often it's a little bit uncomfortable to start because it's a new movement pattern. Tissues have to get used to it. But like anything, the more we practice it, the more we get used to it. Let's go for 3 more, keeping that right arm up in the air. Nice and slow, and just maintain your regular breathing there as well. Good. Once you've done, just shake your legs out a little bit, shake your arms out a little bit, and then we're going to go on to the opposite side. So we're going to go feet wide, toes pointing outwards, left hand is straight up in the air, reaching up to the sky. Right hand's pointing down. This time my left hip goes out and I'm reaching down and back up. Down and up. If there's any shoulder issues, like just having your arm up overhead, you can really do it without that as well if you want to. So you can go straight down. But if you can get your arm up, let's do that. Good. All right, we've got 3 more. Slow, controlled. Last one. Good. Okay. I'm going to shake it out, shake the legs out a little bit here as well. Now, the next one we're going to do, the last standing one that we're going to do, is what we call hip hurdles. Now, if you're near a wall, use the wall, or if you can get your hand on the back of the chair, do that. I'm going to use my foam roller here. And we're going to go, we'll go with our right leg first, sorry. We're going to stand nice and tall, nice, good, tall posture. We're then going to lift one knee up, and we are going to open the hip all the way and bring our feet back together. So up and high, imagine like you're trying to get over a step or a little hurdle, and opening. Up and around. Now, keep going. We'll do another 4 on that side. We do not want to sacrifice our posture, so I'll show you a side view here. We don't want to kind of bring our body towards our knee and crouch into it. We want to maintain good, upright torso. We should feel a good bit of stretching or some stuff happening on your inner thigh there. It can be a bit grisly sometimes. All right, let's swap to the other side. And let's go for nice 6 really big circles. Really important to remember if you're dealing with back pain or you're just looking to have a strong, mobile and resilient back, that it's not just about the lower back. We got to look above and below. We got to look at the hips. We got to look at the hamstrings and the calves. We've got to look obviously at the mid back, the thoracic spine, and we have to look at the lats, those muscles down the side of the body. We have to address it holistically. And that's one mistake I often find with the back pain rehab side of things that we do a lot of is people often just get too honed in on just looking after maybe where they're a bit stiff, sore, or achy. Often we got to look above, below, look around the area and work on not only stretching and mobility, but also on the strength side of things. All right, now we're on to hands and knees. So first thing we're going to start with is a cat stretch, my all-time favorite, very common stretch. We're going to be hands under the shoulders. We're going to be knees directly under hips. We're going to start with a big curl. So we want to start by tucking our tailbone underneath, so rounding our lower back, pushing through our hands to round our mid-back and tucking our chin to our chest. We're then going to do the opposite. We're going to arch and tilt our pelvis forward. We're going to extend our chest bone so it's pointing forward, and we're going to look right up to the ceiling. And we're going to go slowly for these. So I want you to take about 3 to 5 seconds to get all the way to the top. And 3 to 5 seconds to get all the way to the bottom. And you're going to find different areas in your spine as you do this. Feel a bit stiff, maybe a bit sensitive. Remember, our rule with the pain is we really don't want much pain at all, if ideally none. If there's like 1 or 2 out of 10, maybe 3 out of 10, it's okay, but nothing more than that. So if you are feeling some discomfort, you can just modify your range of motion. Just don't go as high into the range or as low into the range, and just start small. Good. Just keep going there. Check the questions here. Slow and controlled. Sorry, Kylie, just saw your question there. So yes, so twisting the shoulder vertically for those, I'm assuming you're talking about the windmills there, keeping it nice and locked out there. Good. All right, now we're going to change the timing up a little bit. So we're going to effectively do the same movement, but this is called a spinal wave. And all we're doing is changing the timing of the motion. So I want you to watch me here first, and I'll show you what the movement looks like, and then we'll guide on how to do it. So this is what the spinal wave is. And all that I'm doing here is I'm starting at my lower back or my tailbone, and I'm finishing at my head. So I'm not doing it all at the same time like we started. We're kind of just making it look wave-like. So how do we do that? Well, very simple. We're going to start at our tailbone. So first, all I want you to do is tuck your tailbone under, start to then round your lower back, your lower vertebra there, and slowly start to round through your mid-back, round through your upper back, and finish with your chin tucked to your chest. Then we're going to start at the tailbone again, and we're going to slowly extend through the tailbone, extend through the lower back, extend through the mid-back, extend through the upper back, and finish with your eyes and your head all the way up. So always starting at the lower back and finishing with your chin either tucked or extended. So it takes a little bit of practice to get this, but this is another little bit of the resilience that we were kind of touching on before. We spoke kind of about movement variety, and this is a really nice option. It's a bit of a skill, requires you to think and to learn a new kind of pattern. And that can really help the neurological system. It can really help the brain fire muscles in a different way and coordinate the movement in a way that it might not have done before. So keep practicing there. If there's any questions on that, you just really let me know there. So good. We're going to go for another just about 15 seconds on these. So starting at your tailbone and working through. Brilliant. Okay. So the next one we're going to do is for our mid-back, and we're going to do something called a thread the needle. So we are again going to start on hands and knees, hands under shoulders, knees under hips. We're going to take our right hand to start with, and we're going to keep our eyes on our fingers. We're going to rotate up to the sky, eyes on fingers the whole time. I'll show you a separate view in a second, but we're going to then come through and we're going to reach across the room. So I'm going to show you that from the opposite side, or I'll show you actually from this angle here. So we're rotating up. And as we come through, my right hand is going behind my left hand. I'm reaching across like I was trying to touch the window on the other side of this room. And then we're going to come back up again. Now notice that as I come through, I am bending my other elbow. So I'm allowing my body to rotate, allowing my head to come down to the ground. And we're reaching. Very important when we get through, not just to be passive there, but actively pull across our body there. A bit more on this side, and then we'll go to the opposite side. All right, let's go to the opposite side. So this time, left arm, we're going to reach, eyes on fingertips all the way up, and we're going to rotate through. And I want you to take a little note, just see if it feels different. Often with these kind of motions, people will find they've got one side that feels really loose and mobile, and Then they go on the other side and they find it feels really stiff and rigid. And the beauty of doing mobility and stretching and being a little bit mindful about it is you can pick up on all these little differences in your body. They're not necessarily good nor bad or anything like that, but it does kind of give us some little insights that otherwise we might not pick up. So keep working through there. We'll do another 3 on each side. And it's those little insights that accumulate. So over time, if we start to realize, hey, my thoracic spine on my right is really stiff when I rotate it, we want to work on that. And that improves a bit of function, improves a bit of mobility, improves how you feel. Maybe it could have even been contributing to some pain or symptoms you might have been experiencing. But it's really good when we do this stuff just to be mindful about it. We're going to learn a lot about our body that's a bit more subtle, that we're not going to often find day to day if we're not doing this kind of stuff. Good. Okay. All right. Now, we're still staying on hands and knees. Now, this one is for our hips. So we are going to take our knees, and I'll show you front on. We are going to go with knees outside of hips. So my hips are here, my knees are out there. My hands are going to come in front. And what we're going to do here is we are going to do some what's called quadruped rocking. So we are trying to maintain a nice neutral back, and we're going to just sit our bum down to our heels, and then we're going to rock forward. So this is a really gentle mobilization for the hips, and we're going to progress on it in just a minute or two. So we're rocking back and forth, maintaining nice neutral lower back as we come all the way down. Some people will have that tendency to want to kind of round their back, and I want you to actually try fight that a little bit in this exercise. So trying to keep nice and neutral. If you've got a book handy or something like that, you can even pop a little book or something on your lower back just to get a bit of feedback to see if that back is rounding at the bottom. For anyone who does squatting and things like that, this can be a really beneficial exercise just to warm up with, because effectively this is a squat, but a really nice way to move the hips. Right, now what we're going to do is we're going to keep doing the same movement effectively, but we are going to start on one side. We're going to do little circles. So we're going to start on our left side. We're going to move to our right side. I'll show you a front on view. So we're going to start with our body over one side. We're going to come down to the left hip. At the bottom, we're going to shift our weight to the right, and then we're going to come up, and then we're going to do the reverse. So we're going to go down on the right and up on the left. And you'll feel likely some stretching in the groin area. Back and forth. Right. Now, the last one, we're going to stay on hands and knees again. I'll show you side view. We're going to do one leg. Now, for this one, you are going to bring your knee. You're going to have to bring one leg a little bit more central. You'll figure it out pretty fast. I want one leg straight back, and we're rocking back and forth. We'll go on our left leg to start. Keep that little right leg nice and straight, and we're just going to do it 6. Sorry, number 3 there. Back and forth. This requires a little bit more stability. And then we'll swap to the other side. I'll show you a front on view here. Rocking back. And again, this challenges that hip. You're in more internal rotation there. So it challenges the hip mobility really well. And again, a really nice one. Just back a bit. Really nice one just to see if there's any differences in your hip mobility. Good. One more. All right. Now, that's our dynamic work. We are now going to finish with 2 long hold stretches. The first stretch we're going to need is just being near a wall. The second stretch is just going to be on the ground. So if you just bear with me for one moment, I'm going to shift my camera around a little bit here. You can see there. Get rid of the mess. It's all the cables behind the camera. So what we're going to do here, make sure I haven't lost my computer. What we're going to do here is we're going to go up against the wall. Bum is going to stay on the wall the whole time. Our feet are about 1 foot away from the wall and parallel to each other. And we are going to fold. I want you to round your back. And we're going to drop slowly lower to the ground. And I want you to cradle your elbows. So you're going to kind of use the weight of your shoulders to hold you down. And we should feel a stretch through the back of the hamstrings and the calves, maybe even through the lower back. And we're going to cradle. We're going to let our head rest. And we're just going to let gravity do its thing here. And we're going to focus on some breath work here. So we're going to take some deep breaths, breathing in through our nose for 3 seconds. And we're going to breathe slowly for 5 seconds out through our mouth. And with every exhale, just see if you can wiggle your way down just a bit. Nothing forceful. Just see through your breath work if you can relax your muscles a little bit more. And we want to feel a bit of a stretch in the lower back. We want to feel it down the hamstrings as well. And keep your bum on the wall. I don't want this to be a leg exercise where you feel like your legs are working really hard to hold you up. I want you to be able to feel balanced so that you can actually round and bend. I'm going to go for 30 more seconds. All right, now when we come back up, hands on your knees, walk and walk and walk your way up. You might feel a little bit stiff coming out of it, all the way up. Now what we're going to do here is we're just going to do a couple little forward extents. My hands are on my hips, and I'm just pushing my hips forward, just gently, just getting some extension there after all that forward flexion. Good. Excellent. All right, I'll turn the camera around. We're going to finish off with our last stretch now. Good. Now, the last stretch we're going to do is called a supine glute stretch, my favorite stretch. Anyone's been in the clinic with me for lower back stuff, you probably have done this. So we are going to start on our back. We're going to we'll start with our right knee up in the air, left hand on right knee, and we're going to rotate and rotate so we let the pelvis come off the ground. My right hand is going to reach and twist. And the goal is that our right shoulder is on the ground and that we can kind of work towards getting our right knee on the ground as well. And we're going to do the same breathing. We're going to take a 3-second inhale. On that 5-second exhale, I want you to really relax all of those muscles. Relax your shoulder, relax your hips and your legs. See if you can get a little bit deeper. I'm just going to show you on the other side. You're going to stay where you are, but I'm going to roll. This is where my hand is here. So that nice big twisting motion. So I'll come back to that right. Eyes closed. Deep breath in, relax. On every exhale, just try soften the body, get a little bit deeper. All right, slowly coming out. Before we move to the other side, let's just bring our legs together just like this, and let's just gently rock from side to side. It's really important after we do all these long hold type stretches, we just get a bit of blood flow back in between. All right, opposite side, right leg goes out straight. Left leg is in the air. With our right hand, we're going to rotate across. And we're looking to feel that stretch along the glute, a little bit into the lower back. And again, we're going to breathe and relax. Close your eyes if you want. Try soften the whole body. Again, another one you can take a little mental note of if you find one side feels a lot stiffer and tighter than the other. Every now and then, just remind yourself to relax. Sometimes we just hold tension. It builds up a bit below the radar. So just relax, consciously relax your shoulders, relax your lower back. All right, now we're going to come back into the middle again. This time we're just going to finish with a few glute bridges. So we're on our back, bum up in the air, squeeze your glutes, wake it back up and come back down. We're just going to do 3 of those. All the way up, squeeze your glutes. And last one. Spot on time. That rarely happens. Perfect. So that's us for tonight. Now, I will send you through a mobility program, so you'll get that likely tomorrow. Keep an eye out in your email for it. It's got a whole bunch of our favorite exercises. Something that's really important if you are dealing with lower back pain, we have a very big workshop coming up on June 14th called our Rebuild Lower Back Pain Workshop. It's one that we run only a couple of times a year, where we're literally going to take you step by step on how to rebuild your back, teach you how to stretch, how to mobilize, teach you activation drills, how to get your core and your glutes strong again. So if you really do want to rebuild your back and get on top of it, there's only, I think at this point, I think there's only about 4 or 5 tickets remaining. So it is all through our website. I'll pop it in an email as well. But if you are very interested in building, getting strength and resilience out of your back and dealing with it for the long term, that's what this workshop is all about. It's 3.5 hours. It's an in-depth dive, but it's very practical with all our coaches on board. Been very popular in the past. So you can message me here and I'll send you a link directly if you'd like, or alternatively, it'll be in the email that I send in the next day or two. If anybody has any questions, I'll hang on here for a couple of minutes. If there are any, just pop them in the chat. And if not, I hope you have a great long weekend for those of you who are in Ipswich. And yeah, we'll see you soon.